very warm welcome to the Action on Dust Summit today. Thank you very much everybody for coming.
Today's session was broadly focusing on dust management in line with the HSE campaign currently.
I'm Julian from RBT. Many will know us as the experts in dust, fume and noise control.
I work for a principal contractor within London, and I came along to this engagement session to learn more about the subject of dust and get other people's views and opinions.
We've had some absolutely excellent speakers. We've had Jennie Armstrong from Tideway, who's the co-chair of the Breathe Freely campaign for construction.
It's really positive to see that people are now recognising that if we have happy and healthy workers, it's good for business, it's good for our workforce, and whether it's work related or not, it ultimately will provide a better industry for us to work within.
She was excellent on the Breathe Freely campaign and also on what Tideway have done, the measures and controls that Tideway put in and the focus they place on that from the very earliest stage of planning a project.
I'm not standing here and saying that we've got all the answers. We've tried really hard and we've definitely made some significant progress.
And Rachel Butler from De Trafford as well, who, again, another absolutely excellent speaker.
Prevention is undoubtedly the most effective option when maintaining the health of our workforce.
I feel so privileged to be asked to be part of the panel and obviously a guest speaker today amongst obviously some very experienced health and safety professionals out there.
It's great to hear from other individuals and be in a room full of people who are actively participating in change in our industry.
David Fishwick, incredibly moving and affecting talk on the effect of silicosis on individual workers.
So you see your workers at work, I see them when they've left or when they get sick. So the quality of air that they're breathing in your workplace dictates exactly what they're going to be like when they leave.
Over the years I've seen lots of stories that would break your heart in relation to people who should be fit but have died or got sick from preventable conditions.
If you are exposing people to silica dust, they will get silicosis. Any system, any biological system has its limits, unfortunately, and the lung is no exception.
The industry on a whole takes it very seriously, but it's about the information getting to the right people.
It would be nice to see a few more black hats, for example, your subcontractors, your typical on-the-ground workers, but also a key theme that emerged from today is that we've got a slight gap with client knowledge and education and understanding around this subject.
We've targeted a lot of the big contractors and the clients. We now want to look at some of the smaller contractors. And this is probably where some of you in the room may be able to get involved and to give some support.
It came under sharp focus today, that you're not really just trying to get messages over to one group, and that actually the interconnections in the real world of business and construction are actually quite complicated.
So the mission that you're all talking about, and I could hear you talking about it at coffee, and that RVT are talking about, for example, is critically important to put me out of a job.
It's to using that education and the campaigns and workshops that we can use their expertise and knowledge and to share that with our supply chain and especially with our workforce, because a lot of the time the workforce would not come to a session like this.
The big industry players should definitely be speaking to their supply chain, but also what we'd like to see is the people in that supply chain then going down to their supply chain and cascading this message down.
Just how do we promote the subject in a manner that we leave a lasting impression to those on the ground?
I feel like the gap that we need to plug is to keep sharing our story, engaging with clients and showing the effectiveness of good health and good control measures so that more people can understand what we're trying to achieve.
If you forget or don't care to think about preventing horrible conditions that relate to dust exposure, inevitably those workers will become my patients or somebody like myself.
From today and from the stats and the figures, we can say we're all actually working through on the right track, but still there's a lot of education, especially to be implemented. We're still unfortunately killing a lot of people in the construction industry suffering with silicosis.
We really need to make the people who are responsible for managing sites and for setting up the design of construction projects aware that there is risk to the workforce and to put in controls as early as possible at the very, very earliest stage to prevent harm to that workforce.
So it is a difficult concept to get hold of if you're a young worker, to understand that you will be anything other than invincible. Meetings like this today, hosted by RVT kindly, allow you to spread those messages.
Today, fantastic, lovely venue, good attendance, caught up with some people I hadn't seen for a while, met some new people, and it's always good to listen to other contractors' points of view.
The venue itself is amazing, it's very fitting. Obviously the British Medical Association is in line with what we're talking about today, so it's been great host, great topics of conversation, even better feedback, and hopefully it'll spread the message as well.